talk about the extension of 20 hours free early childhood education that we announced in the budget yesterday. In addition to extending 20 hours free to 2-year-olds, we've also putting in extra money for pay parity for early childhood education teachers. We're extending, we're boosting funding rates overall across the board in early childhood education so that they can keep up with increased costs and also make sure that these young people are getting the very best deal possible from their early childhood education. Happy to open up for questions.
The budget yesterday, was it perhaps a cynical attempt to prevent national rollback should they get elected? I mean, $5 prescriptions, no government would take those, put those back on the table, would they?
Well, it's difficult to know what the National Party's position is on prescriptions. Yesterday they were saying they were going to reintroduce the prescriptions. Today they're saying they're going to target them. They don't seem to be particularly consistent between any of their spokespeople about it, exactly what it is that they're proposing to do. It's difficult to know what their position actually is.
This was a cut-your-cloth budget, but it's quite a high spend. Was there any sort of mind paid to how this would impact inflationary pressures?
This has been quite a tightly constrained budget, so we've made the extra spending decisions that we've made very carefully in light of the fact that we do want to see inflation getting back down to that 1 to 3% target range. Treasury's forecasts are that we'll get back to that 1 to 3% target range by the end of next year. That's going to ease the pressure on all Kiwi households. So we were very mindful of that when we made the spending decisions in the budget, not to add to the inflationary pressure.
Was a who's who of ministers there at the youth centre before. Are we kicking off the election here in Hamilton?
No, this was to do with, the announcement that we made there involved local members of Parliament, but also all of the relevant ministers. And I think what it highlights is that when you're dealing with something as complex as youth offending, you've got to make sure that you're getting all of the arms of government lined up to do that. So it's going to involve police, it's going to involve education, it's going to involve oranga tamariki. And so the ministerial presence there reflected the fact that all of those ministers at various points have been working on this.
You've been speaking with whānau and teachers here today, obviously about this extension to free education. What has the reaction been? Are they happy with it?
We've had a really positive response from parents around the extension of 20 hours. I know how much of a difference that's going to make to families. For one child, in that two-year age bracket, could save families $130 a week. That's a significant saving for families. So for those families who have 2-year-olds and even those who have just been through the early childhood system, they'll know what a big difference this is going to make.
Why did you make prescriptions free for everyone, not just community service card holders?
At the end of the day, cost shouldn't be a barrier to people being able to access the medicine that they need in order to stay healthy or to get healthy if they have been unwell. This is something that we can do that ensures that we end up with fewer people in our emergency departments with avoidable illness, because in some cases people haven't been collecting their prescriptions, and as a result they've ended up their health conditions have got worse, when actually if they were getting their prescriptions they could avoid further interaction with the health system. So it's actually a preventative measure. Ultimately, I believe that making prescriptions free is going to save the health system money.
On that point, is making people wait a year for surgery, though, really something to celebrate?
We've clearly got work to do around reducing our waiting lists, and I know that Te Whatu Ora have very, very focused on that.
Why was orthopaedics carved out, though?
If you've got specifics on how health are managing their waiting lists and so on, probably best to direct those questions to the Minister of Health.
Whilst this is great news, I guess, for ECE, can Kohanga Rail and Puna Rail also fit within this package?
So with regard to Kohanga Rail, yes, we do want to ensure that 20 hours free is available in Kohanga Rail, but the funding mechanisms that we use for Kohanga are slightly different to the ones we use for other services, because Kohanga Rail want to have a different funding system. So we'll continue to work with them to make sure that we can realise this ambition in the Kohanga sector as well.
And have you had a meeting about that?
I haven't yet. Obviously, post-budget, I'm sure that our relevant ministers, and we've got the Associate Minister of Education here, I'm sure that we'll continue to do that.
Why wasn't that the case?
Generally speaking, we don't meet with the groups who are benefiting from the budget until after the budget's been delivered.
Could you have done more, though, to reduce waiting lists? I mean, that obviously is a balance, but could you have done more to get those waiting lists down? Because they're very long.
There is a real, drive within Te Whatu Ora to make sure that we're getting wait lists back down again. We know that the disruption that we've seen in the last few years has had an impact on waiting lists. People had their surgeries deferred, for example, when there was COVID-19 lockdowns or where there was other disruption to the health system, and when they were dealing with the peak in COVID-19 cases, that's had an impact on the overall waiting lists. They are working with the private sector sector as well, to make sure that we're drawing on the private sector expertise and the private sector capacity in order to help bring some of those waiting lists down. So it is an area of real focus. The Minister of Health has indicated that the 3 Ws are her focus, and of course wait lists are one of those 3 Ws.
Wait lists for GPs, or the wait times for GPs rather, are also a problem. How are New Zealanders going to access these free prescriptions if they can't see their family doctors?
The issue around GPs, it's variable across the country. So in some areas we know that the GP situation's quite tight, and people are having to wait a bit longer to see their GPs. We continue to work on that. We've got a workforce strategy in place to get more GPs out into the community. That doesn't happen overnight. It typically takes 7 or 8 years to train a new doctor, sometimes longer, and as a result we need to make sure that this is a longer term challenge, so we've got to get more GPs into the community to deal with that.
The Waitangi Tribunal yesterday said that the Stats New Zealand definition of homelessness has undercounted Māori homelessness. Does this concern you?
I'd want to see that before I made a comment on it. I haven't had an opportunity to read that.
It also says that
yet.
the government spent years ignoring Māori homelessness, leading to housing insecurity and associated problems. What's your response to that?
I can't speak for previous governments, but certainly I can speak for our government. When I look at the things that we've been doing around Papakainga housing, for example, we've had a real focus on homelessness and providing warm, dry homes for Māori whānau, and that involves working with iwi. It involves, and Papakainga housing is a really good example of how we've been doing that.
Today you also visited the Kirikiriroa Family Services Trust as well as the event afterwards with fast tracking. What's that all about?
We know that we can do a better job for the young people who find themselves on a pathway to more regular offending if we intervene earlier. So when a young person's getting into trouble repeatedly, we want to get them back onto the straight and narrow. The fast track program puts intensive support around that young person. We launched it last year, and as a result we know that of those young people who we've been targeting through the fast tracking program, we've seen reoffending rates absolutely plummeting. So more than 70% of those young people haven't reoffended after being on the fast track program. Of course we want to continue to increase on that number. We don't want to see these young people reoffending, but compared to other things that have been tried, it's much more successful than some of the other things that we've done in the past. So that's why we're expanding it.
And why is there an upsurge in youth offending?
I think the drivers behind youth offending are very complex. A lot of it is to do with wider societal social dysfunction. These kids are coming from very complex backgrounds. They live very complex lives. What we've got to do as a government is make sure that we are supporting them through the circumstances that they find themselves in, so that they've got better choices and better options, and so that they're not falling into a pathway of repeat offending.
Is your coming here today?
Māori tamariki are also 3 times more likely than non-Māori to actually be known by police if they're reoffending at 14 years age. Are you surprised by those things?
I think we've got a lot of work to do to make sure that our criminal justice system, and that's all aspects of it, is delivering fair and equitable outcomes right the way across the board, and I'm certainly completely open about that. Programs like the one that we launched this morning or extended this morning will help to reduce the rate of offending amongst all population demographics, including Māori, and as a result we will see fewer of those young people in that repeat cycle of offending.
Māori services say that mainstream services aren't cutting it. What's your response to that?
I think we've got to make sure, when it comes to youth offending, that we're responding to local needs in a local way. What you saw this morning were some very local services being supported by central government to deliver services to a local community. There is no one-size-fits-all solution here. It's going to be locally led and community led.
Can you provide
Is your coming here today, though, underlining a stance that you do not want to take a punitive approach to youth offending?
I absolutely want to ensure that young people face the consequences for their actions when they are involved in youth offending, but in the way we approach that, we're ensuring that we get them back on the straight and narrow rather than doing things that lead them onto a cycle of lifelong offending.
Can you provide a bit of insight into some of those discussions you had with Hamilton's Mayor Paula Southgate when you were Police Minister?
Yes, I was up here. It was probably just under a year ago now, and we had some good conversations about the youth offending that we were seeing here in the Waikato area. And her request was for a partnership approach. It was for central and local government to work together with local community organisations in order to try and reduce the level of offending in the first place. So a lot of focus has gone on how do you deter offending, so putting bollards in place and all of those sorts of things. But actually the Mayor's focus, and my focus too, has been on how do we stop the offending happening in the first place. And so that's where today's announcement came from. It came from the notion that actually if we give young people better choices and better options, we can actually have fewer offenders in the first place.
The young man who spoke, Mikhail, he laid down a wero for you, that this would just be the beginning of these processes. Pending its success, is that something the government is keen on rolling out elsewhere?
We're absolutely interested in evidence-based solutions when it comes to youth offending. We want to do things that work, things that reduce the number of young people offending, and that where they do offend gets them back onto the straight and narrow as quickly as possible. We don't want to do things that ultimately make the cycle worse, which a lot of our criminal justice approaches in the past have done.
Do you think that is enough to break the cycle?
Like I said, the work that we've seen from things like the fast track, the evidence we've seen from things like fast track so far is that about 70% of those young people haven't reoffended. Contrasting that with some of the more punitive approaches we've taken in the past, which have typically led young people to a more regular pattern of offending, it's actually quite successful. That's why we're expanding it.
In the background to these sorts of programs, were they sort of autochthonous? Were they come up with here in the Waikato, or did you lend ideas from overseas? How did that come about?
A lot of these solutions do come up locally. So it's where you get a group of passionate people who understand their communities, who want to do something different. It's a matter of central government, local government, mana whenua and community organisations working together to identify the best solutions in each community.
So are they tested then?
They're tested as we're doing them. So the fast track program, for example, we launched that last year. So we've had at least half a year to test it, and the results have been really positive compared to what we were doing in the past, which is why we're expanding it. But we'll keep evaluating and we'll keep looking at it. If you wait for evidence of things that work in an area where you haven't tried different things, you'll be waiting a long time. So you have to try the different things and figure out what works and what doesn't. If we try something and it doesn't work, then we won't keep going with it. But if we try something and it does work, then you can expect us to expand it. All right, thanks everybody.
Thank you.